Hey, Red Arrow. Welcome to the stream. Hello, hello. We are going to be learning about prosthetic valves today. Or at least I will be. Anybody has any questions? Feel free to ask. We're going for lime juice and ginger beer. Ooh, that looks nice. Very pretty. I think before I dive into the valves, I'm going to look over valvular heart diseases first. Let's see. Okay, so for mitral stenosis, we've got diastolic doming of the anterior mitral valve leaflet. I need to go over these severity scales later too, I think. Let's see here. Leaflet thickening, left atrial smoke, thrombus, D-shaped left ventricular. Really? Okay, so when the pressure overloads in the right ventricle, it creates a D-shaped left ventricle, but mitral stenosis can also do that. I'm glad I'm going over this again. All right. Dilated right atrium, superior vena cava, inferior vena cava, and hepatic vein. Because everything backs up when the left heart is messed up. Right regurgitation, we've got left atrial enlargement, left ventricular volume overload pattern with left ventricular dilation, hyperkinesis, and LVH. AOV notching. That's mitral valve regurgitation, and I think it's is that also aortic insufficiency? I thought there was notching in another one. I'll watch for it. So atrial stenosis, we've got football-shaped doming, calcified cusps, MAC, LAE, LVH, dilation, decreased ejection fraction. For aortic insufficiency, we've got a diastolic flutter, left ventricular overload pattern, volume overload. The mitral valve closes early and the aortic valve opens early. That's important too. Because if you look at the EKG and you see that the valves are closing on the mitral valve early, that'll be a red flag to check for aortic regurgitation. Right, tricuspid stenosis. Tethered leaflets, right atrial enlargement, dilated IVC. Well, these are pretty intuitive for the tricuspid stenosis. Paradoxical septal motion for the tricuspid regurgitation. And of course, all the dilated things. For pulmonary stenosis, we've got a decreased pulmonary valve area, right ventricular hypertrophy, flattened IVS, and a D-shaped left ventricle. When the pressure is too high, you get that D-shaped left ventricle because they smoosh up next to each other. Okay. I guess I'll go over the rest of this later. You need to go over the Doppler too. There was a question on the last test about the severity scale for pulmonary stenosis, and I straight up did I did the mitral stenosis severity scale, which is like 3 times more complicated. And that's not an exaggeration, it's 3 times more complicated. I got that so wrong. That was like 8 points off on that one question. Fantastic. All right. Let's get into some pulmonary mitral aortic prosthetics. Don't really do too much with tricuspid generally. I've been told that there's more happening with the right side of the heart now than there used to be. So whenever it is that I get into clinicals, I'll probably see a lot more. I'm gonna pour this all over my books, I know I am. I want to believe in myself, but I also don't want to set myself up for failure here. Look at that. Amazing. Okay. All of these were unnecessary. That's nice. Should have more confidence in myself, I guess. All right, prosthetic heart valves. Once again, this should be review, but there's a lot. There's a lot to know. I found my purple highlighter and it was behind the bed and I meant to grab it and then I never did, so I still am missing my purple highlighter. Alright, here we go. Prosthetic heart valve is implanted in cases of hemodynamically insignificant valvular heart disease such as regurgitation, stenosis, and ineffective endocarditis. Oh, infective. Infective endocarditis, or IE, or an aortic dissection with severe aortic regurgitation. Ooh, I don't like that. Okay, so PHV, prosthetic heart valves, categorized by bioprosthetic and mechanical. So bioprosthetic is going to be like bovine, and that's going to be made from the pericardium of a cow. And porcine, I think, is what the other one is. The porcine is made from actual pig valves, so like a direct one-to-one. And the mechanicals are really cool. I like them. All right, so biological tissue and synthetic, made for young patients or for elderly patients, made for long-term use or for those at increased risk of thromboembolism. I mean, all of those are true. Yeah. Valve repair is preferred over valve replacement. That's probably true. Yeah, valve repair is preferred. So replacing is complicated. I guess repairing is complicated too, but you can't put back the original. Here's an ideal candidate for mechanical prosthetic valves. Looks like children, young adults, except those in childbearing years. I think that's probably changing as well. You are so bright. Oh, I never started it. That's why. It's like, why is she so bright? Maybe we should just pause and go somewhere else. Let's go to Berlin. Oh my goodness. That's it? That's my only outfit? It's fine, I guess. We're just gonna have some wine. Okay. So, ideal candidate for mechanical. Children and young adults. They want to use the bio ones on the elderly because they don't actually last as long. Children and young adults last a little bit longer. Bioprosthetic valves estimate to last 30 plus years. True or false? I think that's false. Yeah, 10 to 15. Identify a disadvantage of a mechanical valve. Audible click, yeah. Increased risk of blood clots, yeah. Requires anticoagulation. No, actually, no. They have cleaners on them, the jet cleaners. There's a click though. A lot of times they want these valves so that they can get off of blood thinners. Stentless heterograft uses animal tissue and was developed to improve hemodynamics and durability of the bioprosthetic valve. Sounds like something that's going to be in our book. Okay. Stentless heterograph. Stentless heterograph developed to improve the hemodynamics and durability of the bioprosthetic valve, also made from a tri-leaflet porcine valve or bovine pericardium. So our stentless heterograph uses animal tissue, and was developed to improve the hemodynamics, and durability, yes. Typically, a porcine valve uses tri-leaflet pig valves mounted on supporting stent, and bovine pericardial valve uses bovine pericardium mounted on a supporting stent. That sounds true as well. Okay. Yeah. Our tea today is, I can't remember. Well, it's mostly holy basil, a little bit of roasted green tea, and there's a flower, hibiscus. It's hibiscus as well, that's why it's pink. And no sugar, just as it is. It's very nice. Okay. The patient's pulmonic valve is excised and relocated to their aortic position. What type of bioprosthetic valve do they have? Oh, that's right, they moved that over. That's so odd. I don't understand why they would want to do that. I think it's an allograft, but it seems odd to do that cut twice, but whatever. I'm not a cardiologist. Okay, it's not the allograft. Is it an autograph? Self to self. Relocate the pulmonary valve, annulus and trunk to the AOV position. Autograft. Okay, alright, so autograft, not allograft. Allograft is homograft. Autograft. Oh my gosh, they all sound so similar. Okay, so the autograft moves self to self. It's a transfer from the pulmonic valve to the aortic valve. Autograft, self to self. Okay. Identify the valve developed in the human aortic valve or dura mater that appears very similar to a native valve. I think that's going to be the homograft. Human to human, developed from the aortic valve or dura mater, which is the brain covering. Stented versus stentless. Yeah. Okay. So the homograft has human aortic valve or dura mater. It is amazing how many different things we use to fix stuff. And it sounds like it's very vague, but like when you donate your organs, they don't just use the ones that you hear about all the time. They use your They use like the casing that your brain comes in for heart stuff, obviously. That's what we just went over. They use your bones, they use all sorts of things. It's a whole buffalo sort of situation. You could be in like a dozen different people, in theory. All prosthetic valves are inherently stenotic. What determines the degree of physiological stenosis? Prosthesis size, site, and type. All of the above. Dehiscence means particles are trapped on the stents or leaflets. No, that's false. Dehiscence is when it rocks loose and you have like, and it's just like loose, bouncing around your heart. Paravalvular leak associated with a bioprosthetic valve is considered a normal finding. I mean, a little one, not like a big one. That's not a good question. Like, how big? Paravalvular. Okay. Yeah, paravalvular leak is not a thing that is okay. So, normal finding, that is false. Manufacturer standards and patients' previous echo reports should be used as a comparison during the serial echo exams. True. Transcatheter aortic valve replacement uses a balloon catheter with a stent-mounted valve crimped on its tip that is threaded over the diseased aortic valve. The balloon is inflated and the new valve is anchored on the top of the diseased aortic valve. All of that sounds true. What I'm wondering is there like something in that sentence that's not quite right that it's going to ding me on, so I'm going to find it in the reading. Ball cage tilting bileaflet transcatheter. Is that on our previous page? Yeah. Transcatheter aortic valve replacement, TAVR. Minimally invasive, uses balloon, femoral artery, stent-mounted valve. Yep, all of that is correct. TAVRs are really cool because you don't have to. It used to be you had to crack somebody's chest open. And that is, I mean, you're breaking all of the bones. you're slicing them down the middle and breaking their chest open. And then when you're done, you have to put it all back together, and you've basically got like big steel twist ties like holding your sternum together. I mean, that's obviously that's a way to put it, but it's not ideal if you can do something that's not invasive like that. That's not like so traumatic, because the recovery from that is long. It's a very long recovery. But if you go up through the femoral artery or the femoral vein, you don't have to do that. You can bring this up in there and then open this balloon, and then the stent is in there, and the stent's just like a cage. It's like a wire cage, and then you've got the valve inside of that, and then the balloon deflates, leaving the new valve, and then you take out that catheter and you're done. I mean, the whole thing takes like an hour. You've got a whole new heart valve. You don't have to crack anything open. You don't have to cut anything up. It's amazing. So, I mean, obviously you have to get in there. So there's a little bit of bleeding, you know, there's a little bit of recovery, but like it's like nothing compared to open heart surgery. So it's pretty cool. The TAVR is amazing. Anyway, identify the least stenotic mechanical valve. Ball and cage, bileaflet, porcine, trileaflet, or tilting disc. I think it's the tilting disc. I don't know, let me see. The ball and cage has been discontinued. And that's a weird thing if you want to Google it. Bjork Shiley. Here we go. Every prosthetic heart valve is inherently stenotic. The degree of physiological stenosis depends on the prosthesis type, size, and site. Rule out stenosis, peak velocity, pressure half time, mean max pressure gradient, and valve area. Perform the appropriate calculations on every echo. Utilize manufacturer standards and previous echo findings. Regurgitation is common. Paravalvular leak is abnormal. Dehiscence occurs when sutures become loose and it breaks free. PVE is an abscess. Pannus is a fibrous growth. And then there's hemolysis. I'm not seeing that it's saying which one is the least stenotic. Maybe it's later on. Stented trileaflet bioprosthetic. Ball and cage. Tilting disc. Bileaflet tilting disc. It looks like the stented trileaflet bioprosthetic is probably the least stenotic, but it's got to be the right size, I guess. I don't know. I think we missed it. Oh. So the mechanical ones have an increased chance of thrombus. Well, the bioprosthetic ones must be... Yeah, the bioprosthetic ones are a decreased risk of thromboembolism. Okay, so the mechanical ones... Ooh, I think I might need to go back and change an answer then. Yep, this one. Beep boop. All of the above. Okay. The least stenotic mechanical valve. Oh, it says least stenotic mechanical, so it's definitely not the porcine. I'm thinking it's going to be the bileaflet. Let's see. Yep, here it is. Least stenotic. St. Jude bileaflet valve is one of the least common prosthetic valves in the United States. I don't think that's true. Let's see. Most common. Yep. False. Most. That is the worst. Split up. I don't think anybody would be able to read that. Most. I'm going to show you this because I've surprised myself with how bad my handwriting is. Look at that insanity. What am I thinking sometimes? All right. Which of the following is a known complication of the mechanical heart valve? Hemolysis, mechanical failure, thrombus, all of the above. Patient presents with a tilting disc valve and a new paravalvular leak is detected on echo. What might be the cause? Dehiscence, prosthetic valve endocarditis, ring abscess, or all of the above. Definitely dehiscence. Ring abscess probably causes that as well. Yeah, leak. Yep. Yeah, it's all of the above. It is normal for mechanical valves to have pannus. Yeah. Fibrous growth that may seriously impact the disc, creating stenosis regurgitation. Just because it's bad doesn't mean it's not normal. I'm gonna say false because it doesn't say here. That's not the information under complications, and it would be under complications, I think, that it was normal. Because it is something that has to be taken care of. A lot of times they'll stick a catheter in there. Take care of that with a couple different ways you could do it. If the patient has mechanical valve and their red blood cells are damaged, what is most likely the diagnosis? It's hemolysis. Patient presents with St. Jude bileaflet tilting disc in the mitral position, and the valve area has decreased significantly compared to last year's echo. What is the most likely diagnosis? Hmm. Physiologic stenosis is a thing. It could be a thrombus. Yeah, I think it's a thrombus. The sonographer is not required to calculate the prosthetic valve area or PG because that information is available on the patient's prosthetic valve identification card. That is false. End mode is not useful in the evaluation of prosthetic disc motion because there's too much artifact. That could be true. I do not know, but I know that the amount of artifact for that is, for mechanical valves, is prohibitive of some views, so. I mean, it's on here, something you can do. I'm gonna say false, just because information is helpful, you know, so if you can get the information, it's helpful. Artifact may be an issue during color flow Doppler exam on a mechanical valve. Therefore, color flow Doppler is not suggested during the TTE. I don't think that's true. I think color is always important. Yeah, that's false. Just because something's hard doesn't mean you shouldn't do it. TE is very helpful to rule out vegetation on the thrombus. True. Alright. Got through these. So that's nice. Alright. I know you were just dying to see what these look like. So the one at the top there, that's the porcine. That's the pig valve. The next one down is the monoleaflet. What's that called? We don't really use those anymore. And then you've got the ball and cage. That's not a thing that is done anymore either. And then the St. Jude's bileaflet, which is that, and the porcine trileaflet are the two that we do. Those are the valves. Alright, the monoleaflet B. Central jet through the trileaflet, making it like a native valve A. First mechanical valve used in 1960. C. Heterograph, Metatronic, Carpenter, Edwards, Hancock, Toronto, SPV. We went through this earlier. The heterograph. I don't remember. I want to say the heterograph is for the porcine. That's what I'd like to say, but we're going to find out for sure. Homographed, heterograph, xenographed. animal to human. Yay! I was right. A. Introduced in 1979, St. Jude's. That is our bileaflet. D. Least stenotic of all the mechanical valves. I think we saw that one was D. Porcine or bovine, A. Let's see here. Elastic ball within a cage mounted on a sewing ring. That is C. Single tilting disc is B. Stented trileaflet bioprosthetic, A. 3 flow patterns that promote central flow. That's D. Turbulent high velocity peripheral circumferential jets. That's B, I think. That could be B and it could be C. Let's skip that. 2 flow pattern through major and minor orifice. That's B. Oh, I think that's C. Yeah. Peripheral circumferential jets. That's going to be C. 2 semicircle tilting discs. That's D. Used in patients where long-term durability is not required. A. All right, I feel pretty confident about that. Infective endocarditis. Oh, it's the only thing I'm going to say about this. If you do IV drugs, please stop. Because the stuff that it puts in your body is not just the drugs, it's also disgusting vegetation that grabs onto your valves like moss on a rock. It eats up your flesh, puts holes in your heart, and then you die. So don't do it. Please. We're going to skip this break. We're going to get ourselves some herbs and berries. Nom 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 nom. The Baron's Blend, a noble mix of boldness of wine and a hint of berry for aristocracy. Well, that's nice. She likes it. Let's get our fishy coins. The little blue one is the first fish I ever got. I can't ever get any more of them because then I won't know which one is her. Alright, back to it. Choose the statement that supports i.e. an infection involving the endothelial layer of the heart, an infection involving the epicardial layer of the heart, an infection involving the myocardium, an infection that only involves the valves. So it involves the endothelial for sure. Let's see. Infective endocarditis is an infection of the endothelial layer of the heart that most commonly affects the valves. However, it may affect the lining of the heart and the great vessels. So we'll say A, the endothelial layer, because the endothelial layer is all over the valves. Veg can erode, ulcerate, and perforate whatever is in its path. True. Majority of veg attaches to blank side of the atrioventricular valves and the blank side of the semilunar valves. I'm thinking the atrial side and the ventricular side. I'm thinking that's B. Let's take a look. Usually attracted to damaged cardiac structure, area of turbulent flow, attaches along with fibrin and platelets, held together by antibodies, and becomes veg. Veg is usually located on the flow side of the valves, the atrial side of the AV valves, and the ventricular side of the SL valves. So yes, that is correct. Identify the statement that supports acute IE. Highly virulent pathogen, typically Staphylococcus aureus. Invasion of abnormal valves, Staphylococcus viridans, sudden onset with slow destruction of cardiac tissue. Thinking highly virulent pathogen, typically Staphylococcus aureus. Highly virulent, typically staph. Subacute IE typically involves Streptococcus aureus. So staph is the acute and the subacute is strep. That's true. A 40-year-old presents with a new high-pitched blowing diastolic decrescendo murmur. That status points to sinus infection. What is the most likely diagnosis? Okay, so it's high-pitched blowing diastolic decrescendo. So if it's diastolic, then it is either the atrioventricular valve and it's stenotic, or it's a semilunar valve and it's regurgitation. I'm thinking stenosis of the oh, maybe not. I don't think any of these are what I was thinking. High-pitched and blowing. Post-sinus infection. It could be aortic regurgitation or pulmonic regurgitation. It could be mitral stenosis or tricuspid stenosis. And it looks like the only thing on there with that description is the regurgitation due to aortic veg. So I'm thinking it's that one. But like the thing is, the high pitched and blowing, okay, that's important, but the fact that you hear it when it's in diastole, that means that well, it's I don't feel like going into it. If anybody has a question about why that is the fact, just ask and I'll explain it, but it's complicated, so I'm just going to move forward. I got a lot to do tonight, so thanks for hanging out with me. Okay, so the status of the mitral valve replacement patient presents with fever, holosystolic murmur, chills, and shortness of breath. What's the most likely diagnosis? So the holosystolic is probably mitral regurgitation. Chills, shortness of breath, they're sick with something. So prosthetic valve endocarditis with mitral regurgitation, stenosis, malfunction, ruptured papillary muscle with severe mitral regurgitation. My goodness. Okay, so I mean, the regurgitation as it is, papillary muscle, like where that would come into play here. It seems like something out of left field. Like, I don't see how you would be able to tell that until you had an echo. But, I mean, maybe you can, and I just don't know how. Prophylactic antibiotics. Complications. Yeah, I'm thinking it's the prosthetic valve endocarditis with mitral regurgitation. All right. The AHA determined that only those with the highest risk of infectious endocarditis should take prophylactic antibiotics prior to certain dental procedures, to include those with cardiac transplant, valvular regurgitation due to structurally abnormal valves, history of IE, prosthetic heart valve, or valve repaired with prosthetic material, or all of the above. Now, they are so stingy with those prophylactic antibiotics because of the superbugs and all that. So, I'm not gonna suppose. I think it's all of the above, but they're really stingy. So I'm gonna take a look in here. Treatment. Oh, did I must have flipped past it. Oh, I did. Here we go. Okay, so there's high risk, intermediate risk, and low risk. So the highest risk, not just high risk, but the highest risk is what you give. Okay, here we go. So we've got a transcatheter implanted prosthesis and homeograft, prosthetic material used for repair, for such as rings, cords, or clips, history of endocarditis, cardiac transplant, unrepaired cyanotic congenital anomaly. Okay, so yeah, it is all of the above. Cool. Only those with specific congenital abnormalities or anomalies are required to take prophylactic antibiotics prior to reproductive, urinary, or GI procedures. Is I remember hearing that was the case. I feel like that was in the lecture, but oh, here we go. For patients with valvular heart disease who are at risk for infective endocarditis in the absence of an active infection prior to a non-dental procedure, such as reproductive, urinary, or GI procedure, it is not recommended. Okay. Okay, false. The AHA determined that medical and dental procedures are more likely to cause infective endocarditis than everyday exposure to bacteria. That's true. Veg that are greater than 5 millimeters, mobile, pedunculated, and have a decreased risk of embolization. That doesn't sound true. It sounds very false. There we go. Embolization occurs when the veg or portion of the veg breaks off and travels to another location in the body. There is an increased risk of embolization with veges that are greater than 5 millimeters, mobile, pedunculated, attached by a stalk. So that is false. Infective endocarditis can create structural and hemodynamic changes such as flail leaflet, intracardiac fistula, or aneurysm. That sounds about right. Yep, aneurysm, flail leaflets, intracardiac fistula, perforation, dehiscence, regurgitation, and stenosis. So that's true. An abscess often presents as an echo-free cavity in the annulus of the infected valve or an echo density in an adjacent structure. Yeah, that sounds right. Yeah. Looks like there's holes, like a Swiss cheese situation in the really bad cases. Oh boy. Group chat's lighting up. What is going on? Somebody asked me if I was allowed, if I remember Prince of Egypt. I wasn't actually allowed to watch that movie when I was a kid. I remember it though. Oh, people posting TikToks in the group chat. We are in the fourth quarter of the year, the last quarter before clinicals. Everyone is tired. We're getting goofy. Okay. Rolling the shoulders. So funny looking back on old cartoons and movies and whatnot. I think media has changed so much. I mean, just in the last 15 years, it's changed immensely. I mean, I'm live streaming. That's not really 20 years ago. That really wouldn't have been a thing I thought about doing. I mean, people were probably doing it, but different ways. Anyway, 16-year-old presents with a history of mitral valve prolapse. large mobile veg attached to the anterior mitral valve leaflet, severe mitral regurgitation, abscess of the mitral valve annulus, positive blood cultures during treatment, develops acute altered mental status. Ooh, that's rough. IE with embolus to the brain, infection in her brain with embolus to the heart, ruptured AMVL with decreased cardiac output, or there's most likely no relation to the mitral valve and her mental status. Yeah. Okay. Let's see. Well, she's definitely got infectious endocarditis for sure, because the blood cultures and the abscess. And during treatment, she started having an altered mental status. I feel pretty confident that it's an IE with an embolus to the brain. Yeah, I feel pretty confident in that. Okay. IE has low association with morbidity and mortality due to low antimicrobial resistance and ease of treatment. That's hard to say because a lot of people don't know they're sick until after it is pretty far along. Despite medical advances, IE is highly associated with morbidity and mortality due to the contributing development of antimicrobial resistance among common pathogens, making them difficult to treat. Oof. Once diagnosed with IE, medications may be required for up to 6 weeks. Surgical repair of an infected valve may be indicated, and prophylactic antibiotics will be prescribed for certain dental procedures. Sounds right. Antibiotics may be required for up to 6 weeks. And we already know that that part is true because we saw it earlier. Identify the statement that best describes a veg. Must be greater than 1 millimeter to be seen by TTE. Must be greater than 3 millimeters to be seen by TEE. Shaggy, swinging, or pedunculated, or all of the above. That sounds all of the above-ish. Because I'm pretty sure, because well, no, I don't, never mind, I take that back. Because the TEE can see it greater than 1 millimeter, but the TTE can see it greater than 3. So those are switched around. So I'm thinking it's shaggy, swinging, and pedunculated. I do wonder where it says that, though, because I'd like to see it. Here we go. TTE is greater than 2 to 3 millimeters, and a TEE is greater than 1, so I was on that. Okay, yep, shaggy and swinging. 25-year-old with a history of IV drug abuse presents to the ER with fever, chills, fatigue, chest pain, and a new hollow systolic murmur. Veg is not detected by echo, therefore one can assume that the patient doesn't have IE. False. Just because you can't see it on TE does not mean that there is not something there. If a veg is detected, what should the sonographer include in the TTE? Assess the valve function, provide multiple windows and views of the veg, size of the veg via planimetry or calipers, all of the above. An aortic valve veg with severe acute aortic regurgitation is detected. What additional echo finding is possible? So we've got AOV systolic flutter, probably. Decreased left ventricular FX. What is it? What are you throwing like new letters in there? What is this? What is this? I'm gonna throw in FX. What is that? Can't just throw in a couple of letters and expect me to know exactly what that is. I hate it when it does that. Jeez. Alright, now we're gonna be detectives. It's so annoying. Man. Okay, whatever. Maybe it's not even a real thing. It probably is. Alright, veg oscillations in the LVOT. Yeah, you should be able to hear something. Or all of the above. I mean, I'm sure about the systolic flutter. Okay. LVEF is usually normal or hyperdynamic due to acute or severe regurgitation. Pericardial effusion is possible. Document and rule out hemodynamic compromise, and heart failure is possible due to severe acute regurgitation. Utilize color flow Doppler to rule out regurgitation and or secondary stenosis. If an abscess or fistula is present, examine the flow through and around. Maybe it's on the next page. I bet it is. Okay, veg oscillations, increased echoes from veg, fluttering, and the blood flow. AOV veg oscillations in the LVOT. Anterior mitral valve leaflet flutter due to air striking the leaflet. Ejection fraction, usually normal or hyperdynamic due to acute or severe regurgitation. Increased left ventricular and diastolic pressure exceeds the left atrial pressure and causes premature mitral valve closure. Increased left ventricular and diastolic pressure causes premature AOV opening. So, I'm not seeing an AOV systolic flutter. Seeing notching. Okay, I think I was wrong. I think it's veg oscillations. Because the flutter is the mitral valve, the anterior mitral valve leaflet, not the aortic. Okay. All right. Now we get to do the picture things. That's always fun. All right, so we've got our M mode findings. Here's our left ventricular posterior wall. Now we've got our anterior mitral valve leaflet. our interventricular septum, our right ventricle, and our right ventricular free wall. And over here is our AOV. Okay, so anterior mitral valve leaflet flutter due to aortic regurgitation caused by AOV veg. Okay. This is in the anterior mitral valve leaflet, so this is the flutter. A. AOV veg oscillations. That is this right here. P. Early closure of the mitral valve caused by the increased left ventricular and diastolic pressure. That is here, I think. Or is it here? It is here. Yeah. Because this is the only one where it actually shows us our where it shows us our electrical system here. It should be closing here, but it's closing here, so that is A. Early opening of AOV caused by increased left ventricular and diastolic pressure. That's C. Hyperdynamic left ventricular FX. Okay, so that's a real thing caused by severe acute regurgitation. Is this like, are they like mistyping ejection fraction? Because when I look over here, it says LVEF is normal or hyperdynamic, and this says hyperdynamic LVFX. So, like, what the heck? I mean, it's this right here, so it's A, but why are there 3 A's though? It's excessive. Okay, so I don't like that. I'm gonna ask the instructor about that. That's fine. Okay, well, that's it. We got it done. Yay! Good for us. Oh, look at that! Right on time! Cool. Let's get our fishy coins. Squish our adorable axolotl. I'm sure everybody's heard that song, right? There's an axolotl on the front lawn, or whatever. There's an axolotl on the lawn chair. Is an axolotl supposed to be there? If you ask an axolotl, he'll be there tomorrow. Penguin waddles in and then the axolotl's gone. It's an awesome song. Love it. Okie dokie. So I'm gonna go ahead and put these in later, because I think it would be boring for you to watch that, because you cannot see my screen when I do that. And, you know, for like, yeah, it's like a school website and stuff, so I can't share that, but I will do something else with you instead. Let's see here. I am not actually like dressed for live stream things right now. I am I am like the epitome of frump currently, so let's see here. Let's switch this over. Yeah, we're gonna switch this over to hanging out. Okie dokie. We're gonna switch this over to some music over here. I don't know if you guys can hear that or not. Yeah, that's pretty nice. Okay. I don't like any of these. Tiny, tiny, tiny. How about we just do this and I make it big? We'll just do that instead. I'll just go over here. And I'll make the chat big. Big chat. Okay, here you go. So this is just a granny stitch, Bernat velvet. It's a lovely dark blue, and it feels amazing. So good. And it's getting cold out. Anybody who's got plants outside, you should definitely bring them in because it's about to get crazy cold out there. I was just trying to use up the scraps when I started this, but then I was like, yeah, let's do a whole thing. I don't think that I'm gonna get another skein of this. I mean, because I got it on sale already, so I think it's extremely unlikely that I will be able to buy it for the same price I got it before. And I mean, this stuff's kind of expensive, so I really don't want to pay whatever they're charging for it now. You know what I mean? So I think what I'll do is see if I have a complementary color in this, which I'm sure I do. Like the cream is pretty nice, so I might do that. All right, where are we at? We're at 3. Cool. You probably can't see that very well. I don't want it too bright because that's a little uncomfortable for me, but I also know what I'm doing, you know. But I actually did most of this while I was watching a guest speaker talk about aortic stenosis and valve replacements during the lecture this week. Absolutely fascinating stuff. I love listening to experts talk about things anyway, you know. And she was getting pretty excited because there were a couple of patients that were doing really, really well. And I don't know if most people like know that there's a lot of doctors out there, like especially surgeons, that really love hearing that patients are doing well. And it's not just like a, oh good, I did a good job. It's like an excited, yay, their life is better. That's the whole reason most people get into this stuff. So it's really nice seeing somebody who has worked so hard and still works so hard, being able to get some joy from making other people's lives objectively better. So it's cool. I don't know what specialty I'm gonna go into yet. Sorry, it's a little bunched up here. Yeah, I don't know what specialty I want yet. I could go into stress echoes or TEEs or just general care. I could do that. Go into pediatrics. What I'd really love to do is general for a while, and then maybe TEEs for a bit, and then go into vascular. I think that would be really cool. Vascular is what I wanted to do in the first place, but I mean, honestly, I'm glad that I went into the cardiac program instead. Because echo is absolutely fascinating. And I feel like it's a great foundation if you're going to go into vascular afterward. I think I will be, I'll be pretty prepared for it, I think, when I go in to get registered for that as well. I'm pretty sure that's a whole other, like another year of schooling. But the school that I go to presently does not offer vascular, which is why I signed up for cardiac in the first place. But after talking with some of the students that have graduated and our class as well, they are considering adding vascular to the available programs. And if that's the case, I would really love that, because I'd love to come back and add that on. The last couple of weeks has been really exciting for me because this stuff gets extremely stressful. It's hard and it is challenging in ways that I was not expecting. I mean, it was pretty rough going there for a little bit. I was losing hope, you know, and that's not going to be the last time that happens, I think. And I had forgotten why I wanted to do this in the first place. Like, smart brain knew, like, the facts. I knew the reasons why, but I wasn't feeling the joy that I felt before, just because of all the stress. But this past couple of weeks has been really a wonderful reminder of how much fun learning about this stuff is. And I just feel fuller when I'm, learning things, I guess. And I'm really excited that I'll be able to help people in this way. I want to go back and rescan all the people that I scanned at the beginning of the program, because I feel like I did nothing to help them. I did nothing to help them. The only thing I did was let me put this down a little bit. The only thing I did was help myself practice. That's it. I wasn't doing anything. Well, I take that back. I think there were two people that I found some pretty important stuff on. But I mean, that was stuff that was so obvious you couldn't miss it. It was too obvious. But I would love to go back and rescan a couple of people now that I know what I'm looking for better, now that I'm better at finding it. So Okay. I think I'll do a row and a half, and then I'll get back to work. For any viewers that like to crochet, there are a ton of fabulous patterns on Hobby for free, HOBBII. They have clothes and squishy things and all sorts of cool stuff. Patterns for free. And I've gotten significantly better at working with patterns than I was, a couple years ago. But I'm still not like the best at it. You can only follow your heart so far when you're crocheting. Unless you're making your own stuff, which I do enjoy doing too. I like doing that. But you end up frogging a lot when you do that, so. If you're looking for like clothing patterns and stuff like that, they've got some cool stuff on there. There's also, oh shoot, I can't remember her name. She sells patterns, like you have to buy them, but she's got some tutorials on her YouTube channel as well. I wish I could remember her name. I might just post that stuff at some point if people want it. I love her patterns. I wish I could remember. There's also Tony with T. Is it TLC Crafts? I think. She's great too. She's not who I was trying to think of, but she has some really wonderful stuff on her website as well, if you're looking for crochet stuff. I love her yarn reviews because she is detailed with what she's talking about. She is so detailed. If you want to know everything about a yarn, if she's done a review on it, you are going to have all the information you need. Yeah, her tutorials are how I learned how to do Tunisian crochet. And actually, I would say that she has a big hand in getting me into crochet again, because my grandmother taught me for I don't know, like forever ago. And then I put it down, and then I pick it up, and then I put it down, But she had a Tunisian crochet tutorial video on her YouTube channel, and I watched that and I was like, that looks like so much fun. And that was a huge motivator for getting me back into it, and I just haven't put it down. Now I've got a yarn. I got a bunch of yarn behind me actually, but making little squishy things and clothing and all sorts of stuff. And this little goth chicken. How cute is this little guy? Yeah, he's a cutie. Little goth chicken. This little cutie too. All my big stuff's in the other room though. Oh, hey, I got a little axolotl. Look at this little guy. It's a cutie too. Yeah, I got a bunch of little stuff sitting here, but all the big plushies are in the other room. That's good stuff though. Good soothing stuff. reminds me. I finished a gift for my brother. And another gift. I really need to send those. Not doing any good sitting in a box on my kitchen table. And it is getting cold. So all that warm stuff's gonna be good for something. I made my grandmother a shawl made out of red velvet, like this same material, except it was like a nice warm red. And I felt bad because I made her two things, and she really wanted cream fringe on it. And I was like, that's going to be like next to impossible for me to do. That is beyond my skill level and the amount of time I had to visit. You know, because I brought the yarn and I made them while I was sitting next to her, you know, but I did get her, like, I gave her the cream border on the ends, and it looked very nice, but I did feel bad that I couldn't give her the fringe that she wanted, but I don't think she realized that how difficult that would be, and she did not mind at all that I didn't do the fringe, so she was really sweet about it. So I need to get down there and visit her. Did I miss it? Oh no, I didn't. I just made it really, that last row was just really tight. I have mice in my quail hutch. Got mixed feelings about that. First of all, they're adorable. Second of all, they're mice, so disease. They're super cute, but they're dirty. They do not want to leave the quail hutch because it's warm, because I've got a heater in there for the birds. And they're not in there with the birds, but they might as well be. You know, they're like right next to them. And part of me is like, well, you know, they need to get out of there. And the other part is like, well, it's going to be 26 degrees next Monday. So they've got like 3 days. They're hunkering down. They found their spot, but I don't know. I feel bad kicking them out. They got so mad the first time that I shook them out, and they were yelling. They ran 4 different directions, and when I shook them out, today, they hopped onto the ground and then they ran straight back for the hutch immediately. Like they'd had a little conference and they were like, "All right, don't go across the street this time. Just go back." She's not going to do anything. It's like, all right, that's cool, I guess. Called my bluff. I just don't want them to eat all the corn, you know? Pigeon's not my favorite, but, you know, I still want her to have her corn. And that's her favorite thing. I swear she goes on a hunger strike when she runs out of corn. Sweet little brat. Old dinosaur. Oh, for anybody who has been keeping up on the Fluffy Butt saga, she is doing great. I think she is pretty much out of the woods. After hand feeding and watering her for over 5 days. She's finally over the cold that she had, and she is standing up just fine and eating and drinking. I think it's probably going to be another week until she's like fully recovered, but she is doing really well. She had me worried. I didn't think she was going to make it. But the other two got the cold, and then she got it. And the other two, she's the runt. She's a runt, and so she doesn't have as much strength to her as the other two do. So I'm not super surprised that it hit her a little harder. And they're all little old ladies. I'm surprised they're all still alive, honestly. Shelby is no longer with us. She passed on Wednesday. She had a nice long life, and she was very pampered. She was a snake, by the way. Creamsicle corn snake. Very huggy. Yeah, she had a nice long life. She was with me for 11 years. She was with a young man who went off to college, I guess, before we got her. So she was well traveled and well loved. It's funny the things that you notice after, something's gone from your life. I did not realize that I would hang out with her while I was on the phone. That was an interesting revelation, because I was on the phone and I walked over to where her tank was and she was not there, and I was like, why am I standing here? And then I was like, oh, okay, because when I'm on the phone, we used to like hang out, and anyway. As somebody who notices lots of things, finding something out about yourself after the fact is very jarring. Usually I'm the person that notices other people doing things. I don't tend to say anything. Since I changed the settings so that only people who are following can talk, my chat has been very quiet. And not a judgment, not a, assessment necessarily, one way or the other. Just different. I think that would probably change if I were playing a game or whatever, or actually like set up to be doing something. But I gotta tell you, when I'm doing homework, absolutely wonderful. I love talking with people, but sometimes the discussion is like so far off topic that it is very distracting. So it's, I think it's been a good choice to do that. But I think I might turn it off for other instances just because I want people to feel welcome, you know? Because they are welcome. Like the rules to be an accurate representation of the vibes. Alright, let's see, what did I do today? I worked on one of the projects. I finished up the homework for 120 and 130. I still have two videos to watch and tests on those, I think. I think I want to go back over my my protocols. I think I want to do that. Maybe. It might be too much. There's a couple of boxes I want to go through, dump out. Been getting a headache from the soap in my bathroom, I think. Not 100% on that, but it seems like the most likely reason. It was new, and it was one of those things where it's like, you know, you try it out. If it doesn't work out, it doesn't work out, you know, but the chances were pretty good that it was going to be fine. And I think that is the only reason that it's taken this long for me to start getting headaches from it, is because it's not bad, but it's not good enough. So, too many allergies. I think we might have locked up. That was interesting. It said no, thank you. One of the nice things about this tea is that, in addition to being a lovely pink because of the hibiscus, it is also good cold, which is important because I will always forget to drink my tea in a timely manner. I feel like I should probably eat something at some point. I've got that Finch app, and one of the goals on there is for me to eat 2 meals a day. Some days I do better than others. Today is not one of those days, apparently. But I will say what I had to eat was really fantastic. I sauteed some mushrooms and red onion, and I mixed up some flour, a little bit of sugar, salt, olive oil, water, and some shredded cheese. And I mixed all that up and made little like dumpling things. It was pretty good. I feel like probably protein would be good, but I don't know. Cheese is protein. Counts. So I was watching an upload of Tail Foundry, which I absolutely love that. 100% recommend Tail Foundry. They have some really cool takes on story tropes and different books and things. The art is fantastic as well. So yeah, if you get a chance, check out Tail Foundry. But I was watching their latest upload on cannibalism in literature. It was good. It was an interesting take. They brought up a couple of books that I hadn't actually read before, so that was neat too. I think that concept is a difficult one to get into in general because from a literary perspective, there's many different ways to commit that. And I don't think it's ever, in the stories that I've read, I don't think it's ever been just one. It's never really just been literal. I think they could have gone further, I guess is what I'm getting at. I feel like they could have gone a little bit deeper with it. But I understand why they didn't, because if you go too far, you get demonetized. So I get that. I guess I'll finish this road and then go get something to eat. Really wanted to get out of the house this weekend, but it's going to be so cold. This winter's gonna be hard. Man, that was a loose stitch. What was I thinking? Wasn't thinking, I guess. I swear my tension is not consistent. I think with velvet it's really hard to do that though. It's very slippery. Like you could think it's fine and it absolutely not be fine. So I don't want to be too hard on myself with the velvet. See, that's like a massive loop. It's silly. I bet it's because I shoved it in that bag. Loosened up some of the stitches, tightened up some of the other ones. That's okay, we'll even it out. We're at the end of the row. 1, 2, 3, 4. I'm gonna start up the next row just so that I'm not confused, because that's the thing that happens. If I leave off in the wrong spot, I might go the wrong direction when I start back up. But now that I did a couple of stitches, I am safe from making that mistake. I'll be so happy when this is done. I love big velvet, big throws. They're so heavy. They're so satisfying. It's like getting smushed by a big cat. All right. This is coming along very nicely. Okie dokie. Have a wonderful night. Drink water. Hug your people. Try and get some sleep.